If you've been trying to fix a left AIC pattern for a while, then you're probably familiar with this test. In physical therapy, we call this the Ober's test, but in PRI, this is the adduction drop test. It tests the ability of the leg to adduct or move towards the table in this position. Now, if it can't, this means a few things. First, it means that you're in the left AIC pattern, and with that being true, that your left pelvis is more forward than your right. And this is the reason that a lot of the traditional left AIC exercises try to shift you back on the left to allow you to achieve a more neutral pelvic position. And if your pelvis is in fact in a neutral position, then the leg should be able to drop and the test should be negative. But if you're someone who's been doing the usual exercises and your test hasn't improved, there might be a simpler reason for that that has nothing to do with whether you're doing the exercises correctly or not. And that is that a pelvis that's more forward on the right can actually produce a positive test on the left. So in this video, we're going to go through a case study of a recent client call that I had. We're going to see someone with a pelvis that's more forward on the right and an adduction drop test that's positive on the left. And believe it or not, what we ended up doing is flipping some of the usual techniques and resolving this test, as well as getting some really cool positive changes with walking. So let's go ahead and dive into this, and we'll see you at the end of the video. All right, so the first thing that we're going to see is a pelvis that is forward and down on the right compared to up and back on the left. This particular client is a PT, so his palpation skills are good. And now we'll see the very positive test on the left with the knee way above midline, and then transitioning over here to the right where we see a much better test, and this would be negative by Ober's criteria. All right, so at this point in the call, you'll notice when he sets up for the test that his belly button is really far back, and he's really tucked under with his pelvis way more than you would expect. And because of this, he's trying to come up and go into extension, but he's already extended via his posterior pelvic tilt, so he can't extend the leg. And that's why he's seeing this very positive test. Now, in a second, I'm going to cue him to try to get the left side of his pelvis just a little bit more into anterior tilt, which is the opposite of what you'd see in a traditional PRI type exercise or cue. So let's go ahead and look at the result that produces.
Yeah, could you do anterior pelvic tilt without the rib cage leading it?
Yeah, that's about it.
Okay, it's a lot closer. So, have you ever heard the phrase like if you can't extend, you can't adduct? Yeah. So if you're getting into the Ober's test and you can't extend the leg, it's not going to drop. If you're laying down, and I'm going to bring your leg up, back, and around, and I'm going to try to drop it, so that as I bring it back from here, right?
Yeah.
It should be able to drop down. However, if I'm tucking like this with the pelvis under, then I'm not even going to be able to extend this all the way back, really. Right? So by the time I get here, there's going to be so much, basically, tension up front. Yeah, you're going to be hanging out way closer to end range extension than you are if you're neutral. It's just because you're already extended axially, and then you're going to come back. It's going to be hard to drop down.
And that's what it feels like during Gait, is that I literally can't extend. Like I'm at end range extension.
Too early. Yeah, and think about what that would do. So if you had your hip like this, and then I go to extend, could you see how that like brings the ball forward in the socket?
Yes.
Do you also see how if that was the case, like this might feel super relieving? When you showed me in the walking, you didn't just internally rotate. You actually kind of like abducted a little bit too when you did it. You can go watch the tape again, but it's like a little bit abduction and internal rotation seemed to kind of like find where it was.
Where neutral. Best. That's right? Great. That's a great
Does that make sense?
Explanation.
All right, so at this point in the video, we've talked about the left side. Let's review that for a second before we go to the right. So the reason we had a positive test and the reason we saw the compensatory leg internal rotation during Gait was because the pelvis was too far tucked under. The pelvis being too far tucked under means that when we go to move the leg back into extension, we're going to reach end range of motion too early. In the context of the testing, we pull back into end range extension, we have too much tension on the front, and that prevents the leg from getting far back enough to even be able to drop. In the context of Gait, we reach end range extension too early, creating tension in the front of the hip. And then to relieve that, the body compensates creatively by moving a leg out to the side and producing internal rotation to recenter the hip socket. In order to fix both of these, we need to restore anterior pelvic tilt to open up space to be able to extend normally. Okay, so now that we understand the left, let's go ahead and jump into the right.
The way the, like, just with the shape of the SI joint, you'd hear people talk about this, would be when the innominate moves forward, which is flexion, would also tend to move into abduction at the inlet, right? And external rotation at the inlet.
Right.
Okay. But look at what that does in the back. So if I move into, this is the right side. If I move into flexion, abduction, and external rotation, it's going to kind of approximate this space. And it's going to, relatively speaking, kind of, I guess you could say, compress the back of the SIJ here. Think about right adductor, what that would do, right? So your foot is fixed to the floor and you contract your right adductor.
Yeah, they usually has an isometric push, yeah.
Yeah.
Yeah, contraction.
And so if I had this relationship, femur fixed, so adductor is going to attach here,
Mm-hmm.
okay, and it's going to attach up into the ischium on the back
Mm-hmm.
and into
Mm-hmm.
the pubis on the front.
Mm-hmm.
So if I have a pubis and an ischium that is now approximating my sacrum and getting further from my adductor because of the forward position of the pelvis and that triplanar relationship. If I keep this fixed and I contract my adductor, it actually abducts the outlet. It actually opens the outlet, right?
Yeah.
Same thing with hamstring. It would, like, if the sagittal orientation is this, hamstring
Yeah.
with a fixed femur would do that,
Yeah.
right? So when you're saying adductor and hamstring on the right make it feel better, my assumption is that it's anterior, abducted, and external rotation at the inlet, adducted at the outlet.
All right, so at this point in the call, we've now covered the right side. He was having a complaint of pain at the bottom of his right sacroiliac joint, and we were talking about the pelvic position and why a right adductor and hamstring exercise could help. So what we were saying was because this right side was forward, this space down here was closed off. By keeping the leg fixed in one spot and then contracting the hamstring and adductor, we could take the pelvis from forward as well as compressed in the back to more posterior rotated and open in the back. So now we're going to get through an actual exercise that reverses the pelvic position from forward on the right, back on the left, to forward on the left and back on the right.
Just, imagine trying to pull the wall down into the floor on your right side to contract your hamstrings a little bit. How's that?
No, that's good.
It's
Should I
good.
bias that more inside or the outside of the foot?
I would go inside,
Okay.
or knee in maybe a little bit to get the adductor in.
Uh-huh.
Okay. Now on your left side, think about pushing the wall up away from the ground to get a little bit of quad going there.
Yeah,
Okay.
that's fine.
You're doing the quad on the left and the hamstring on the right. Can you get the feeling of giving me a little bit of APT on the left and then relative letting the pelvis stay in posterior toward the right? So almost like a little transverse rotation over towards the right side. With your left leg, you're going to straighten your knee up away from the wall to contract your left quad a little harder while keeping your right pulling down. And you're just going to do like little reps like that.
Let's see.
Yep. And now we're going to practice reaching your left knee forward of your right, just like you're pushing your left knee straight ahead in space. And what you'd want to feel as you do this is your left pelvis tipping forward just a little bit, kind of arching in the lower back, if anything. And you'll feel a little bit of, as you're doing that, a little bit of opening in the front of the hip. So you're moving into relative external rotation. And you're getting a little bit of the kind of upper glute region on that side. And then once you're there, and you got some left quad and glute going, then hold that and exhale and adduct your right knee up towards your left. Just to give you a little bit of adductor there, but not so much that your pelvis wants to turn back, just a little bit of tension.
For me,
Yeah.
like I can really feel the left is actually working, which is like never. Every time I've done this kind of stuff, I
Yeah.
always felt like it's just been like rotating the wrong way
Yeah.
or not really getting there. Whereas that's like, yeah, felt like it's actually working.
All right, so there you have it. We had someone with a right pelvis that was forward and a positive left adduction drop test. We ended up improving that test and helping this person walk better by flipping the usual techniques. Now, if you're confused about this and the biomechanics behind it, I've got a couple of ways that I can help you. If you're a coach or clinician and want to learn more, then go ahead to the link in the description and apply for the priority list to my Applied Biomechanics Mentorship program. And if you're an adult that wants help creating a comprehensive program that fits your body, then go ahead and apply for one-on-one coaching. As always, thanks a lot for watching this video. Leave me any questions you have down below in the comments. And until next time, peace.